now we're going to shift into what I call an inverted sit position. Knees are bent in front, hands are coming down at the hips or a little bit behind the hips. Fingers can be turned out or turned back. Once we get here, I want to press into the floor, getting the spine nice and tall. We're going to turn our elbow pits out and away so that you feel your shoulder blades sliding down your back. I want to feel that chest as opened up as possible through the front. Once we find that position, if you want to bring your legs into a cross-legged sit, that's fine, but I'm maintaining this downward pressure, spiraled elbow, open chest. We're going to do some neck mobility. Neck mobility is incredibly important, especially if you drive, because I want you to be able to see your blind spots in order to keep you safe. So we're going to start with that one, checking our blind spots. So I want to keep those hands actively pressed down. I don't want our shoulders getting soft off the floor to where they start to shrug up. So we're actively pressing down, getting our spine as tall as possible. It's like we're trying to lift the top of the head to touch the ceiling. On our inhale, fill up that crocodile breath. On the exhale, starting to let your head turn and look over your right shoulder. Inhale as we bring it back to the center. Exhale as we look over the left shoulder. And as I'm going side to side, I want to keep my head straight and tall. I want to avoid tilting my forehead and reaching more with my forehead. And in order to do that, we're going to actually reach with our chin. So as I turn, I want to see how far can I get that end of my chin over the edge of the shoulder. The more we reach from that chin, the deeper into the cervical joints that we're able to mobilize. And as you're doing this, again, notice what's the difference? Left or right? Does one side feel easier, smoother? Does the other side feel, it's a little tighter? I don't go as far. My chin does not reach that same point. Again, this is a super important assessment point. Once we get 5 to 10 reps, we're going to come back to our starting point, and now we're going to do a tilt and a lift. So eyes are going to stay straight. We're going to tilt our ear lightly towards one shoulder. This is not a heavy tilt. I'm not trying to touch my shoulder. I'm just barely letting it tilt. And from here, my opposite ear, I'm lifting up like I have a piece of string pulling on it, or like I'm literally trying to touch the ceiling with that ear. Inhale comes to center. Exhale, lightly tilt to the other side and lift. As we're lifting with that ear, so as I lift with my right ear, we can lightly downward press through the right shoulder in order to create a little bit more traction in the neck. And again, how does this feel on the right side compared to the left side? Is it smoother, easier? Does one side feel tighter? I want to assess the hands on this as well. Since we're downwardly pressing through the shoulder, are you able to get more pressure into one hand and more lift to where it's like, I feel more connection and control on one side? Does the other side, it's harder to push down. It's harder to get that lift. It's harder to feel in that area. These are important assessment points. Once we get our 5 to 10, the last one for the neck is going to be glide. This one's going to feel weird, and it can look a little funny too. Continuing to downwardly press through the shoulders. I want to keep the cheekbones on the same plane. So I don't want the head to tilt, and I don't want the head to rotate. This is ideally done in front of a mirror or in front of a camera so that you can see the position of your head. From here, we're going to exhale as we glide basically towards your shoulder. Inhale as we come back to the center, and exhale as we glide to the other side. Now, you may find that you can glide well in one direction, and when you get to the other direction, it just doesn't want to do it. The head wants to turn or it wants to tilt, and that's normal and that's okay. But that's an important assessment point. We want to work on this until we get smoother in both directions. This is a functional movement of our neck, and if you can't do it on both sides, that's going to affect other movements within your body. So this is an important one to assess, and if it's out of balance, to work on it.